Hello everyone, I'm Laura Omila and I'll be presenting my group to talk about the health benefits of breastfeeding versus infant formula for newborns. We'll be talking about the introduction, the epidemiology and public health issues and levels of prevention associated with breastfeeding. Breastfeeding is the act of feeding infant breast milk either directly or indirectly by pumping out milk from the breast and bottle feeding it to the infant. It is one of the most effective ways to maintain an infant's health and survival, as it provides infants with the essential nutrients and calories needed for their growth and development. It is recommended by health officials to exclusively breastfeed infants for the first 6 months of their life, and afterwards, breastfeeding should be continued along with introducing appropriate complementary food. So, breastfeeding is composed of 86 to 89% of water, 6.9 to 7.2% of carbohydrate in form of lactose, 0.2% of micronutrient, 3.3 to 5% of fat, and 0.8 to 0.9% of protein. The composition of breast milk doesn't vary amongst race, age, and ethnicity, so those factors don't affect breast milk. Formula feeding is the act of feeding infants formula milk. It can be used after the infant's first 6 months of exclusive breastfeeding, together with breastfeeding and introducing new diets. It is not recommended during the first 6 months of the infant's life, as it mimics breast milk, but it doesn't provide all the nutrients and benefits of breast milk. However, it can be recommended by healthcare professionals on rare occasions, such as the presence of certain health issues, like hypoglycemia or dehydration in the infant, or infection or the use of drug or certain medications in the mother. Now we'll talk about the epidemiology and public health issues associated with breastfeeding and infant formula. Breastfeeding has effectively improved the child's health and survival, and also affects the health of the lactating mother. In addition, breast milk has reduced childhood infections such as morbidity and mortality. According to a meta-analysis data from LMIC, optimal breastfeeding for the 6 months of life has reduced infection by 88%. Infant formula mimics the nutrition of breast milk and monitored to meet national and international quality of infants globally. Formula milk has nutrients similar to breast milk, such as iron, nucleotide, and composition of fat blend. Additional nutrients, such as genetic engineering probiotics and compounds, are added to formula. So the public health issues associated with breastfeeding. It's essential to fill the public health issues with breastfeeding since it promotes health, prevents disease, and helps reduce inequalities. Breastfeeding can not only help the infant but also helps the mother. Now we'll talk about the pros and cons associated with breastfeeding. Breastfeeding can boost the infant's health with the required nutrients it needs to grow. Breastfeeding can reduce digestive system problems. It can strengthen the baby's immune system and boost the baby's IQ. It can cause breastfeeding. It can cause discomfort to the mother. The mother has to be careful what she eats, as whatever she eats can be passed down to the infant through her milk, and it is hard to manage when the mother is returning to work. Now, formula milk mimics breast milk, as we previously mentioned, but it also lacks the essential nutrients to help protect the infant. Typical health issues from using formula milk include the risks of infants developing food allergies, nutrition deficiencies, and contaminations. Studies have shown that infants fed formula milk are more likely to develop respiratory infections, allergies, chances of sudden infant death syndrome, obesity, and cognitive development issues. The pros and cons of formula milk. So infant formula advantages are allowing alternative ways to nourish infant. They provide another alternative for mothers who cannot breastfeed due to medical issues. They also allow not only mothers bond with their child, but also for other family members. And formula feeding allows infants to get the nutrients and bonding they need in the household with two fathers. The cost of formula feeding, it costs around $800 to $2,800 a year with formula feeding. Formula-fed infants will miss out on certain immune and cognitive developmental benefit. Premise-fed cow milk infants formula can have a higher risk of severe digestive disorder called necrotizing enterosclerosis. Now we'll talk about the level of prevention associated with breastfeeding. Breastfeeding can be linked to two prevention levels. The first one is the primordial stage. This stage involves the acts that helps in preventing the development of risk factors in specific population. It covers three main levels, which are risk factors, specific population, and interventions. So an example of primordial prevention with breastfeeding is breast milk constitutes all the vital nutrients of an infant, which will help reduce malnutrition. Breastfeeding offers the infant all the nutrients needed for the body system development, facilitating an appropriate growth rate and reducing low growth rate in the infant. Breastfeeding provides the infant with the necessary nutrients needed to develop the immune system. The second prevention phase displays from the benefits of breastfeeding is the primary level of prevention. At its core, this level involves an action taken before disease onset. Essentially, the primary level of prevention encompasses actions that eliminate the possibility of disease occurrence. This level consists of an action, which is breastfeeding, the goal, which is to prevent the onset of illness, and the target population, which is in infants. So the CDC provides an example of how the primary level of intervention can help prevent the onset of diseases through breastfeeding. Breast milk enables mothers to share antibodies with the baby, paving the way for a strong immune system capable of preventing the onset of different ailments. Breastfeeding gives the infants nutrients to grow their immunity, making them capable of fighting off pathogens. And breastfed babies typically illustrate lower vulnerability risks to illnesses like asthma, type 1 diabetes, and obesity. Here are references, and thank you for listening.